Hello, welcome to another anatomy and physiology lecture. Okay, so today we are going to talk about the appendicular skeleton, and also just introduce the skeleton in general. Okay, so in introduction, you know that the skeleton is composed of the bones, cartilages, and joints that form the internal framework, and it has bones. And the bones' function is to provide support and shape to the body, attachment sites for muscle, storage depo- deposits. So it also acts as a storage deposit for essential minerals. It also protects soft tissues, and that's where the blood cell formation and energy storage occurs. Okay, that's about bones. And how do you classify the same bones? So classification can classify them according to the shape into long, short, flat, irregular, and sesamoid bones. Then they can also be classified according to their developmental history into endochondral or membranous bones. Then the types of bones that we have can have long bones, and after we have mentioned the types. Now we are now going in details into the types like we just mentioned, the types and the examples under each type. So starting with long bones, it includes the clavicle, humerus, radius, ulna, femur, tibia, fibula, metacarpals, and the phalanges. Okay, and it is developed by the replacement of eye-line cartilage plate, which is known as the endochondral ossification, except well for the clavicle, which does not develop by this process. Then they have a shaft, which is the diaphysis, and two ends, which is the epiphysis. Okay. Then the metaphysis is a part of the diaphysis adjacent to the epiphysis. So in short, together we have the epiphysis, metaphysis, and the diaphysis. These are the three anatomical parts of the long bones. Okay, then we also give examples of short bones. So short bones are approximately cuboidal shaped, and they include the carpal and the tarsal bones. Then they are composed of sponge bone and marrow surrounded by a thin outer layer of compact bone. Okay. Then what about flat bones? So flat bones consist of two layers of compact bone enclosing spongy bone and marrow space, which is the diploid. Okay. Then the flat bones include the ribs, sternum, scapula, and bones in the vault of the skull. Those are flat bones. Okay, so we can make progress. So the other types which we mentioned, of course, starting with the irregular bones, they contain most sponge bone enveloped by a thin outer layer of compact bone, and include bones of mixed shapes such as bones of the vertebra. Okay, then the sesamoid bones develop in certain tendons and reduce friction on the tendon and thus protecting it from excessive wear. That's the sesamoid bone. And they are commonly found where tendons cross the ends of the long bones in the limbs, as in the wrist and the knee. That is an example would be the patella. Okay, and we're done the sesamoid bones, and this is what we were just talking about. So the long bone, an example is the humerus. Short bone, the if you get the couple bones here, so an example would be trapezoid. This is a trapezoid, which is short bone. You can also get C, which is a flat bone. An example would be the sternum. You can also get irregular bone. An example would be the vertebra, and this is the left lateral view. Then the skeleton can be divided in two subgroups. So the skeleton can be divided into two subgroups. Number one group is the exoskeleton. Two is the appendicular skeleton. Then there are 206 named bones of the human skeleton, but you have to know that when a human being is born, they are actually 270 and they reduce to 206 due to fusion and other mechanisms. Then the exoskeleton consists of the bones of the skull, meaning the cranium, vertebral column, ribs, and the sternum. That's the exoskeleton. Then the appendicular skeleton consists of the bones of the pectoral girdle, pelvic girdle, and the upper and lower limbs. This is the appendicular skeleton. But specifically in this lecture, we are going to actually discuss appendicular skeleton. Okay, we are just wanted to introduce the skeleton in general, then now discuss the appendicular skeleton in details. So initially discovered by Robert Hooke in okay, sorry, this is okay. So I think I had put a long slide here. Okay, so the appendicular skeleton, the components of the appendicular skeleton, that it has two pairs of limbs and two girdles. Then the pectoral, which is the shoulder, and which is the shoulder girdle, attaches upper limbs. That's the pectoral girdle, or the shoulder girdle just attaches the upper limbs. Then the pelvic girdle, the hip girdle, secures the lower limbs. Then it has three segmented limbs. We have the upper limb, which is the arm, and the upper limb, which has the arm, forearm, and hand. Okay, but most people find that they will refer to it as arm. Okay, then the lower limb, which most people refer to as leg, but remember the lower limb has the thigh, leg, and the foot anatomically. Okay, so those are the components. So this is the pectoral girdle, which is the shoulder girdle, and it has the clavicle anterior, and also the collarbone, as this is called. Then it has also the sternal end. The sternal end of the clavicle attaches to the manubrium medially, and the acromial ends articulates with the scapula laterally. Then the scapula is posterior, and that's where the shoulder blade is. So this is the scapula we are talking about, and this is the clavicle and the pectoral girdle this side. Okay, that's the anatomy of the clavicle. We are talking about the laterally. We were talking of the acromial. Okay, that's the acromial joint at the acromial end. Then the medial end as the what we call the sternal end. And this is the posterior, and this is the anterior, and this is the right clavicle superior view. Then the anterior, then the other on the anterior view, and if you were to get this into another view, you have to know that the acromial end will be this side, which is on the same side, and the colon tubercle here, trapezoid lines here, and the sternal end this side, and the impression of for the costoclavicular ligament. So this is typical about the pelvic girdle and the anatomy of the clavicle. Okay, then the scapula is which is of course is triangular, paired, but don't connect in back, and adds the thoracic flexibility. So this is the anatomy of the scapula. So this is the right scapula anterior aspect and the right scapula posterior aspect. Okay, so these are the parts. So this is the acromion, the coracoid process, the suprascapular notch, the superior border, and the superior angle, then the glenoid cavity here, the lateral border here, subscapular fossa here, the middle border here, then the inferior angle this side. Okay, then the lateral border again the same. So we have the same structures even this side. Okay, so this is known as the supraspinous fossa, and this is of course where the called the spine, and this is the infraspinous fossa, and this is the middle border. Okay, so we are done on the scapula, and in terms of how it looks like from way back. So again, if you go in details, where you have to talk about where now the glenoid cavity. So the glenoid cavity articulates with the humerus, and the acromion articulates with clavicles. Okay, then the coracoid process projects anteriorly. So we are talking about the parts of the scapula, but the lateral aspect now. So this is the lateral aspect. So the glenoid cavity, which is this side, we say it is articulates with the humerus, then acromion articulates with the clavicle, and the coronoid process projects anteriorly. Okay, anteriorly. Then the upper limbs, so the arm or the brachium, which is the upper limb and is found between the shoulders and the elbow. Okay, so this is the for easy remembrance, where the humerus is, that's the arm. Okay, then the forearm, that's where the radius and ulna is, which is known as the antebrachium. Then the hand, when they use hand, means where now all things included the wrist, palm, and the finger. So the wrist has the carpal bones or the carpus, the palm has the metacarpus or the metacarpal bones, then the fingers have the phalanges. Okay, that's about the upper extremity. Okay, then go in details on the arm. So the arm, we said it has only the humerus. So the humerus is the only bone, and if an exam was to come, maybe draw a long bone, okay, at least you can actually try to draw the humerus, and this is how it looks like. Then the edge of the humerus fits into the glenoid cavity of the scapula, and distal and medially we have the trochlea, which articulates with the ulna. Then distal and laterally, the capitulum articulates with the radius. Then medial and laterally we have the epicondyles. Okay, so this is the anatomy in terms of anterior view and posterior view. We have the capitulum, which are the ones we are writing. You have the radiofossa, the lateral supracondylar ridge. So this is the supracondylar ridge. Okay, then the coronoid fossa, olecranon fossa this side, and these are the medial epicondyles. Okay, then the deltoid tuberosity this side, and the radial groove this side. Then this is anatomically known as the surgical neck. So apply the anatomy. If someone has a fracture this side, if someone has a fracture this side, we call it a surgical neck fracture. Okay, so hope we are together on that one. Then this is the greater tubercle, the lesser tubercle, intertubercular sulcus, then the head of humerus, the anatomical neck this side. So they have the surgical neck and the anatomical neck. Then that's the right humerus there now, the anterior view. This is how it looks like. Okay, so we have gone through this. You can even pause and even just go through on your own. Okay, we make progress. This is now the posterior view. Okay, and now in details again. Okay, so let's make progress. So we now go to the forearm. So the forearm says it has two bones which articulate with each other proximally and distally. So we have the ulna and the radius. Then apart from that, in between we have what we are calling the interosseous membrane. So interosseous membrane is now which is found between the two bones. The ulna, as on the ulna, the olecranon hinges with the humerus, forming the elbow. Then the styloid process distally. Then the radius contributes to wrist joint. Then the styloid process anchors the ligament to the wrist and the thumb side. So how do you know that the radius? So the radius is on the thumb side, then the ulna is on the little finger side. So that's how anatomically, if maybe you forget where exactly shown is the ulna, maybe by palpating. Okay, so you can just say the thumb side, that's where the radius is. Then where the little finger is, that's where the ulna is. Okay, so this is the radius and this is the ulna, the interosseous membrane, then the head of radius, neck of radius, and that's how anatomically these are the parts. Okay, then apply the anatomy here. Apply the anatomy. We have like fractures. They can occur maybe just on one bone or both bones, and it's something that you have to know anatomically which bone has been fractured and whatnot. Okay, so apart from fractures, of course, there are other things as well which we can discuss. Okay, but this is just for anatomy and physiology. Okay, so but let's make progress. So this is now the right forearm anterior view and of the radius and the ulna, of course, and this is the anterior view, and the interosseous membrane is here. Okay, so you can pause and even just go through. Okay, and this is the posterior view. Okay, so you can pause again and go through. Okay, anatomically. Okay, so we can move on. So in the anatomical position, the radius is lateral on the thumb side, like we explained. Then with pronation of the palm faces posteriorly and the bones close each other. So that's why it's very important to know where from the thumb where your radius is. Then promotion is when you have to move the forearm into the prone position. Then supination will remove it back into the anatomical position. So prone means the body will be facing face down, then supine the body will be lying face up. Okay, then the hands, the proximal is the wrist and it has 8 carpal bones. Okay, on the hand, so the hand has the carpal bones, and these are the 8 carpal bones. And the 8 carpal bones, we have the scaphoid, trapezium, trapezoid, okay, lunate, traquetro, pisiform, capitate, and armat. Okay, those are the carpal bones. Okay, so those are the 8 carpal bones. And on the palm of the hand, you have the 5 metacarpals. So we have the 5 metacarpals. Then on the fingers or digits consist of miniature long phalanges. Okay, those are what we are calling digits or fingers. So these are phalanges, which are long miniature miniature bones. Okay, so we can make progress. Okay, so this is the hand and the couple bones. Okay, so the couple bones are there are 8, like we explained. You have the lunate, traquetro, pisiform, armat, trapezoid, trapezium, scaphoid, and capitate. And this is where the radius is on the thumb side, and on the little finger, that's where the ulna is. Okay, then you have 5 metacarpals, which will make up the palm, and the fingers, that's where the phalanges are, but we have the proximal and the middle and the distal. Okay, so the carpal bones, the carpus, in Greek means wrist. It's made up of 8 couple bones and they are arranged in 2 rows. So the proximal row, which is lateral to the middle, as a scaphoid, which means from the word Greek, scaphoid is Greek, which means boat. Then lunate is Latin for moon-shaped. Then traquetro is Latin for three-cornered. Then pisiform is Greek for pear. That's the proximal row. Then the distal row has the trapezium, meaning four-sided. Then trapezoid, meaning baby's shoe. Then capitate means head. Then armate means hook. Okay, those are the couple bones. Then the pelvic, we are done on the shoulder girdle and going down from the arm, forearm, and hand. Okay, so now the pelvic girdle. So the pelvic girdle is strongly attached to the exoskeleton, which is the sacrum, where the sacrum is, and it has deep sockets. It is more stable than the pectoral girdle. But there is less freedom of movement, and this is made up of paired hip bones. We have the bone pelvis, which is the basin-like structure, and the hip bones plus the axial and the coccyx. These are the structures. So this is the hip bone. Okay, this is the hip bone, which are 3 separate bones in childhood. During childhood, which fuse together. So we have the ilium, ischium, and the pubis. Okay, so this is the ischium, the ilium, and that's where the pubis is. Okay, so we can make progress. So together that's the coxco bones, or the coccyx, or the hip bone. So anatomically, there is an iliac crest. So the iliac crest is where I'm highlighting. Then the anterior superior iliac crest, again, that's where I was writing, but now anteriorly, if you were to palpate yourself, that's where the anterior superior iliac crest will be. Then you have the greater sciatic notch, then greater sciatic notch, then in between that forms part of the acetabulum, that's the iliac crest, then which is the hip socket, which receives ball-shaped head of femur. So the ilium forms at least half, forms part of the acetabulum. Okay, so that's what we're talking about. Then the body, okay, that's where the ischium is. Then and we have the ramus, we have the ischial spine, we have the ischial tuberosity, and it's also part of the socket. Okay, then we have the pubis. Then under the pubis, it joins medially in pubic symphysis, and it forms the obliterator foramen, which is a large O with a ischium, and it is also part of the socket. Okay, then these are the hip bones, now separated and put in right hip bone lateral view and the right hip bone medial view. Okay, so we have the body, you have the ischium, and you have the pubis. That's what we are talking about. Okay, then the acetabulum, that's where the socket is. Okay, so we can make progress on this one. We can just pause and even just go through the other structures. Okay, so the pelvis is divided into 2 parts by the pelvic brim. So above the pelvic brim is the false pelvis, which forms part of the abdominal cavity. Then below the brim is the true pelvis. And the pelvic brim is formed by the sacropromontory, which is anterior and upper margin of the first sacral vertebra behind. And the other part is the iliopectoral lines, which is the line that runs downward and forward around the inner surface of the ilium, laterally, and finally the syphilis pubis, which join between the bodies of the pubic bones anteriorly. These are the uh, three structures that form the pelvic brim. Okay, so this is the pelvic brim we're talking about, as highlighted or by the red lines. So above that, that's down below, that's where above is the false pelvis, down is the true pelvis. So the false pelvis is above the lines. That's where the false pelvis is. Okay. Then you have to also compare the male and the female pelvic. Okay. So in terms of the bone pelvis in males and females, it is different. In terms of general structure, the male one is thicker and heavier, whilst the female one is thinner and lighter. Then the greater pelvis, which is the pelvis major, is deeper in males and shallower in females. Then in bone pelvis is then the lesser pelvis, which is the pelvis minor. In males it is narrower and deeper, whilst in females it is wider, narrow, shallower, and it is cylindrical. Then the pelvic inlet, which is the superior pelvic aperture, in males it is heart-shaped and narrower. Then in females it's more oval, rounded, and wider. Then again, apart from knowing the male and female types, we also know we can also even just talk about the types of pelvis, meaning the gynecoid, android, paratyperoid, and anthropoid. Okay, so you know that the gynecoid is the typical female pelvis and the android is the male pelvis. So now that's when now if we were to go in details, but that's mostly on in obs and gyn, and we have a lecture on types of pelvis. Feel free to check up on the channel the types of pelvis, and there's a 5-minute lecture on the types of pelvis where we discuss them in details and their differences with each other. Okay, then the lower limb we have the lower limb, the thigh, is made up of the femur. Then the leg has two bones, it has the tibia and the fibula. So we have the tibia and the fibula. So the tibia is one which looks bigger. So the tibia is big, and the fibula is small. Then if you go to the foot, that's where they have the tarsal bones, the metatarsal bones, and the phalanges. Okay, that's about the lower limb. So starting with the thigh, so the femur is the bone which is there, and the femur is the largest and longest and the strongest bone in the body. Okay, and the head of the femur fits in the socket over the pelvis, and the neck is the weakest part. Then it has the greater trochanter, then distally, the lateral and the middle epicondyles are distally it has the lateral and middle condyles and epicondyles. Then the patella is the sesame D bone. Okay, that's on the thigh. This is the femur, and this is the structure anteriorly and posteriorly. Okay, of the neck, of the head, of the lesser trochanter, the greater trochanter, the intertrochanteric crests. Okay, then the intertrochanteric line here. Then you have the gluteal tuberosity, you have the linea aspera, you have the lateral epicondyle, the patella surface is this side, and the medial epicondyles are this. Okay, then these are the lateral epicondyle. Okay, and this is the medial and lateral supracondylar lines. Okay, so this is the anterior view. You can pause and go through. Okay, then this is the posterior view. You can also again pause and go through. Remember, you might be asked to draw a long bone, so it's very important that at least you have ideas on how the long bones are. Okay, then the leg. We are done with the thigh, so the leg. has two bones, like we said. We have the tibia and the fibula. So the fibula was the small bone, and the tibia was the bigger bone. Okay, so the tibia is a shin bone, and it has medial and lateral condyles. It has the tibial tuberosity. It has the distal medial malleolus, which is where we have the medial ankle. So we have the distal one and the medial malleolus. Then the fibula has the distal and it has the distolateral malleolus, so that's where the lateral ankle is. Okay, so the tibia has the distal medial malleolus, whilst the fibula has the distal lateral malleolus. We are together. So when you are in anatomical position, then the one which is on the distal medial malleolus, that's the from the tibia. Then the distal lateral malleolus, that's which is the lateral ankle, that's from the fibula. Okay, so we can make progress. Then apart from that, it also has the interosseous membrane. So we have the fibula here, the tibia here, then the lateral malleolus is formed by the fibula, that's the lateral malleolus. Then the medial malleolus is formed by the tibia. That's what we are talking about the distal, medial, and distal lateral. Okay, so I think we can make progress and go to the next part. So this is the anterior view of the leg. Okay, this is the right lower leg. Okay, then this is the posterior view. And remember, pause and even just go through the structures and as we make progress. Okay, so this is the foot now. So we're done with the right lower leg. Now this is the foot. Okay, so the foot has the tarsal bones, which is the tarsus. So there are 7 tarsal bones. So we have the talus, which articulate with the tibia and fibula anteriorly and calcaneus posteriorly. Then the calcaneus is the heel bone, and smaller cuboidal, navicular, and 3 cuneiforms: the medial, intermediate, and the laterals. So let me repeat. So 1, we have the talus. 2, we have the calcaneus. 3, we have the smaller cuboid. 4, navicular. Then 4 plus 3, that's 7. But the 3 are cuneiforms. We have the medial, intermediate, and the lateral cuneiforms. Okay, hope we are together on the 7 tarsal bones on the foot. Okay, so we have the first tarsals here, and that's where we have the medial cuneiform, the intermediate cuneiform, this is the calcaneus, and this is the talus, that's the navicular. Okay, so I think we can make progress and go. So then this is where the 5th metatarsal is. So 5th metatarsal, first metatarsal, this side. Okay, then we also have metatarsals, but the metatarsals are 5. Okay, they have 5 metatarsals, so meaning we just count them to say 1st to 5th metatarsal. Then phalanges, we have 14 phalanges. Then greater toe is known as the hallux. Okay, this is the inferior or the plantar view of the right foot, and which is again the superior view. So we said you have the phalanges, which are 14. You have the metatarsal bones, which are 5. Then you have the tarsal bones, which are 7. Okay, that's what we are talking about. Okay, so the calcaneus, talus, 3 cuneiforms, cuboid, and the navicular. That's the types of bones we are talking about. Okay, this is the middle view now, and again, remember the calcaneus, that's the U bone we were talking about. Okay, so we can even pause and even go through once again. Okay, so let's make progress. So these are the arc. So the arcs of the legs, of the middle longitudinal arc, the transverse arc, and the lateral longitudinal arc. So this is how they are. Okay, then probably these are things you have to know under the appendicular skeleton, and this is the checkpoint. So so meaning we want to check whatever our length. Okay, so these are the questions you need to ask yourself and answer at the end of this lecture. So which bones or parts of bones of the pectoral girdle form the sternoclavicular, acromioclavicular, and the glenohumeral joints? That's one. Then two, name the bones that form the upper limb from proximal to distal. Describe the joints of the upper limb and the bones that form the joints. Then describe the distinction characteristics of the individual bones of the pelvic girdle. Then distinguish between the false and the true pelvis. Then name the bones that form the lower limb from proximal to distal. Then describe the joints of the lower limbs and the bones that form the joints. Then what are the functions of the arcs of the foot? Then when and how do the bones develop? And thank you once again for coming to this lecture and the human anatomy physiology tutorial videos and even the playlists. Okay, and thank you for watching us again. Please subscribe and hit the bell notification, and see you on the next tutorial video. And feel free to check out the other videos, especially on the types of pelvis that we have, that at least you have ideas on what's what on the types of pelvis. Okay, thank you.